What is liposuction?
Yeah, actually, liposuction is a procedure that we treat the fat in the body. It's a minimally invasive surgical procedure, right? And then so we are taking out the unwanted and the disproportionate fat, which is distributed in the certain body parts. Actually, it's not taking out the whole fat in the body. So there is some people, there are some areas that the fat is disproportionately deposited, like your flanks and the tummy and the back of your chest, sometimes your butt. So the liposuction is taking out that fat with a minimally invasive surgical procedure. So in certain part of the body, that whatever you do exercises, diet, or whatever you do, this part of the fat will not go away. So that part can be easily and successfully treated with a liposuction procedure.
Is it a weight loss surgery?
Actually, it is not a weight loss surgery. A lot of people think that liposuction can reduce your body weight, and it is a treatment for your reduce your target body weight. Mind you, that is not a weight loss surgery. That is for removal of the unwanted disproportionate fat in your body. So it will not reduce your weight, and you should have a targeted weight by your exercises and diet to come for a liposuction, that we can take it out the unnecessary and unwanted fat by the liposuction, which is very resistant to your diet and the exercises.
Which parts of the body can be treated?
The parts of the body can be treated when liposuction from face to toes. Actually, we're going with the body parts in the face, the chin area, and then the neck area, which is most people are thinking that they have a double chin. So that area can be treated successfully with the liposuction. And the chest, especially in the males, it have a hormonal issues. It has an enlargement of the male breast that we call the gynecomastia. So that issue can be easily treated with a liposuction without any surgical procedure at the moment. No cuts, only for 2 tiny holes and taken out the unwanted bulky chest in your body, as well as the flanks that we call the love handles, and the lower abdomen, and the back of the chest, the butts, and the upper thigh. Even the arms can be treated successfully with the liposuction to get your body shape or body contouring.
How is the procedure done?
It is a minimally invasive surgical procedure, and we have a special instrument called the cannula, which is about the size of a 0.5 millimeter, a hollow instrument, which is inserted to the area which need to be liposucked under general anesthesia, or sometimes in a small area it can be done under local anesthesia, or the local sedation that you are in the twilight situation, which is not absolute anesthesia. So with the cannula is connected to the machine that is giving the vibration and the vacuum. So the unwanted fat, which is braked out by the vibration and sucked out to the vacuum machine. So that is the procedure usually done, and we are doing about a 0.5 centimeter hole to insert the cannula. So that's the surgical cut that you will get after the liposuction.
What are the side effects of liposuction?
Considering the side effects, if you're going for the general anesthesia, there is a common side effect that you can go with a surgery in any type of a surgery, and you go for anesthesia. But considering the liposuction, that today is the technology is more advanced, and then the surgical safety and the theaters are well advanced. So there is no massive or no large side effects that endangering life that you undergo for a liposuction. But you can have a bit of a bruising on the skin, and sometimes maybe the infection very rarely we can be treated successfully, and there is no such major side effects if you go with the liposuction with the current instruments and the current safety techniques which we have in the theaters.
What are the things that would need to be taken into consideration post-procedure?
So after this can be done in the day surgery procedure, that you come and get it done and go from the hospital out at the same day. So after the surgery, you have to wear a special garment that we call the pressure garment for about 2 weeks, and then for 24 hours. But you can take it out for your washing and the other things. But you can go for a gym or the exercises exactly after 2 weeks if you don't have any issues or pain or anything. You can go for normal activity after 2-3 days after surgery with your pressure garments in. The liposuction is a minimally invasive surgical procedure, so you can go after you go back to work even after 3 days after surgery with if you are doing not strenuous exercises or not strenuous work like a sedentary work. After 2 weeks, you can go to gym and you can do the exercises. You can go back to swimming, whatever the things that you are used to it in your lifestyle. You can go back to normal lifestyle after 2 weeks. When you are preparing for liposuction procedure, what I recommend you is to do the exercises and go to gym and do the dieting and get rid of the fat as much as you can. Then you will see an unwanted fat which is very resistant to your exercises and the diet. So, that part we can successfully remove with a liposuction procedure. There is no major preparation needed, then you can admit to the hospital at the same day, and we need about 6 hours fasting for if you go for a general anesthesia, and it is a day surgery procedure, and you can go back home at the same day after surgery if there is no any issues with a special pressure garment that we are providing you for a while.